Medical practitioners and civil society members have over the past decade been calling for the government to increase the amount of money allocated to the health sector. The ruling party promised to significantly improve the health sector in its 2016 manifesto, but the situation is too pathetic for scores of Ugandans. One of the government's proposals to turn around the state of affairs is the introduction of the National Health Insurance Scheme. The proposal has been on the shelves for more than 10 years. Now, members of the Uganda Medical Association, who are attending a scientific conference in Kampala, have expressed concern of the delay in establishing the scheme.
You will all recall that it is now over a quarter of a century, about 25 years, since this idea of looking for alternative financing of healthcare started to be discussed in the country.
They believe the scheme will go a long way in relieving ordinary Ugandans of the huge burden of paying health care, despite some opposition to it.
Our group of experts in Uganda Medical Association have taken some time to study the proposed schemes, and even some of them have been piloted, and we are coming to the conclusion that the scheme is workable in Uganda. For instance,
the scheme is aimed at improving easy access to medical care to all Ugandans. In the draft, the plan is to promote social solidarity through a pooled financial risk mechanism for healthcare access, where the rich can subsidize the poor, the single can subsidize the families, the healthy can subsidize the unhealthy, and lastly, the young shall subsidize the old.
Yes, that possibly those who are already contributing NSSF, that money should also benefit them in the sense of spreading to health insurance. So NSSF alone could be a pool of resources for those already contributing, so that those who are not contributing then can have a separate scheme. So the idea is really to pool resources somehow and make it useful in as far as health is concerned.
One of the reasons the association is giving for the delay in establishing the scheme is the fear for the source of funding.
Get money in anything and you can get it. Anything you want. The bottom line is money. Let's put more money there. We are not even, some people thought health workers are demanding for more pay. We are not demanding for more pay. We are demanding for facilitation to do our work.
Other than South Sudan, Uganda is the only country in East Africa that has not established the Universal Insurance Health Scheme.
More importantly, we think the contribution from the health insurance scheme will bring some of the equipment, the modern equipment that Ugandans are going abroad to access.
The medics insist that the only way the government will overcome the challenges that are facing the health sector is to establish the scheme.
It may therefore make our health-seeking behavior even better, because our poor people in the villages are better running to traditionalists. They are running to the shrine just because they cannot afford care at the pay out-of-pocket user facilities.
The health sector has over the years faced numerous challenges, which include poor infrastructure, lack of drugs in hospitals, poor working conditions medics go through.
Remember, calamity strikes less when you're prepared, and it strikes more when you're not prepared. And how prepared are we to always foot these bills, given our salaries, given our economy?
The doctors have also expressed fear of the increased massive brain drain in their profession from Uganda to neighboring countries, which they say is a result of poor working conditions. The Ugandan Constitution stipulates its government's role in ensuring provision of basic medical services to the population. Ivan Chimuchigozi, NTV.